Hello everyone and welcome back to Clinical Cousins YouTube channel, where today we're going to go over the hex-axial system and the precordial system. Now, the most important rule today is that we must remember that the positive end of the leads are like cameras, and they take pictures of the electrical activity that is going on in the heart. That is what the EKG tracing is. It is basically the information or pictures that our leads have taken of the electrical activity of the heart. Now, basically, our three limb leads make what is called Eindhoven's triangle. It is basically a triangle that catches all of the possible electrical impulses of the heart. Now, it is important to know that this Eindhoven triangle, or this triangle around the heart, is like a net that is catching all of the impulses generated by the heart in the coronal plane. Remember that the coronal plane is like if we cut the body from ear to ear and separate it into front and back halves. Now, the EKG system also does some calculations based on these three leads to give us Avr, Avl, and Avf. These are called augmented limb leads, and they also act as little cameras or little eyeballs that are looking at the electrical activity of the heart from different angles. Now, it is important that we know these angles at which the limb leads and augmented leads are located, because it will tell us the direction at which they are looking at the electrical activity of the heart. And remember, the positive lead cameras are looking at the coronal or the front view of the heart. Now, first we must learn a dance. It goes right left, right lower left, left down. Again, right left, right lower left, left down. Or negative positive, negative positive, negative positive. This helps us remember leads 1, leads 2, and leads 3. Lead 1 is generated by right to left. Basically, lead 1 is generated across the chest. Next, we have lead 2, which starts at our right shoulder and moves down towards the apex of the heart. Lastly, we have lead 3, which is generated from moving from the left shoulder toward the pelvis. Now, we have learned our dance of the limb leads, and we must know the position of the augmented limb leads, which means we must memorize the angles at which these lead cameras are looking from. Now, lead 1 makes an axis across the chest. When we move the axis towards the position of the heart, as shown here, see we have the axis of lead 1. And what we do is we shift that down to look at the heart, which I've done here. Basically, the positive end of the lead, or camera, ends up on the left side of the heart. We say that this is 0 degrees. We base the rest of the hex-axial system on lead 1, which is 0 degrees. Next, we have lead 2. And when we shift lead 2 down towards the heart, the positive end ends up at the apex of the heart, located here. We say that lead 2 sits at positive 60 degrees. Now, when we shift the axis of lead 3 down to the level of the heart, we see that the positive end of this angle is located at positive 120 degrees. Remember, lead 1 is looking from 0 degrees. Lead 2 is looking from positive 60 degrees. And lead 3 is looking from positive 120 degrees. Now, we must not forget our augmented limb leads, Avr, Avl, and Avf. Let's start with the Avf camera. Now, remember F for feet. Avf is located at the most inferior part of the heart and is oriented at positive 90 degrees, which means that Avf sits at positive 90 degrees and looks up. Next, we have the Avr camera. This is located upwards and rightwards. And remember that all of our leads so far have been below and positive. Therefore, we can predict that the high Avr lead will be negative. In fact, the Avr camera, or positive lead, is located at negative 150 degrees and is looking at the heart from this angle. Lastly, we have the Avl camera. This camera is located upward and leftward and has an angle of negative 30 degrees. This means that Avl is looking at the heart from this angle. Now, this is why we call it the hex-axial system. It is hex, meaning 6 lead cameras, and axial, meaning the electrical axis that is generated by each lead. Hex-axial. The 6 leads look at the heart from 6 different angles. Now remember, all of these angles are on the frontal plane, meaning electrical impulses that are moving like this. To review, we have lead 1 looking from 0 degrees. We have lead 2 looking from positive 60 degrees, or the apex. We have lead 3, which is looking from positive 120 degrees. We have lead AVF, which is looking from positive 90 degrees. Basically, it's looking up at the heart. AVR is looking from negative 150 degrees, and AVL is looking from negative 30 degrees. Now, watch how we can apply this information. If you have a patient who has had an infarction of the inferior left ventricle, which cameras would be able to take a picture of this infarct? The cameras in lead 2 are looking at this. The cameras in lead AVF are looking at this. And the cameras in lead 3 are also looking at this. Now we are beginning to learn how useful the EKG can be. So if our patient has had a heart attack or an injury to the heart in the inferior portion, we will be able to see it in leads 2, AVF, and 3. Now, we must learn about the precordial, or the chest leads. There are 6 chest leads, then they are V1 through V6. We already know the placement of these leads from our 12-lead EKG placement video. We must know that the precordial chest leads look directly into the heart, meaning they look from the transverse plane, or this way. Remember, coronal is this way, while transverse is looking directly into us. Basically, this means that this view cuts the top and bottom half of the heart. Now, we must know that leads V1 and V2 are looking at the septum of the heart. Leads 3 and 4 are looking at the anterior wall of the heart. Leads 5 and 6 are looking at the left lateral aspect of the heart. Now, many of you know the 1-2 step, and when we are talking about chest leads, we must remember the 1-2 septal. Remember, it's not 1-2 step, remember 1-2 septal. Also, remember 3-4 anterior, or front portion of the heart. And lastly, remember 5 and 6, look at the lateral aspect of the heart. Now, let's put it all together. If you have a patient who is actively having an inferolateral MI, or heart attack, which cameras will be able to see this damage? Let's break this down. Which cameras would be able to see the inferior damage? Well, lead 3 would be looking at this damage, AVF would be looking at this damage, and lead 2 would be looking at this damage for the inferior portion of the heart. Next, let's think about which lead cameras would be able to see the lateral aspect of the heart. These are, lead 1 is looking at this, right? Lead AVL is looking at this. Also, lead 5 is looking at this, and lead 6 are looking at this. Now let's put it all together. In an inferolateral MI, it would show an abnormal EKG deflection at leads 3, AVF, 2, AVL, 1, 5, and 6. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.